Good afternoon, I'm Dr. Peter Jones and I've been a GP for 25 years and I've been working at Clee medical practice for a few months now with Dr. Elton and Dr. Bassett. I've known Dr. Bassett for many years and I'm very pleased to be here. Hopefully I'll get to know you all soon. I'll just say I'm looking forward to working with everyone, all of the team here. Thank you. I shall just show you what PPE looks like. When you come and see us, you'll probably find we're wearing PPE for much of the consultations. Please do not be fazed by this. We're still the same behind the mask. Okay, so this is what full PPE looks like. Please not be upset or worried by that. It's for everybody's protection. And hopefully you'll be able to hear us okay. If there are particular reasons why we don't need to wear it, we won't do.
Hello and welcome to the July meeting of the Clee Medical Practice Patient Group, which is rather different to normal, but everything's different to normal in these circumstances, isn't it? Most of you know me, I'm Tina Ranson. We have with us Dr. Bassett, Dr. Elton and Dr. Peter Jones. And thanks also to Luke, who's recording this for us. So very kindly you have submitted some questions which you would like answers to from the doctors. So I shall be putting the questions that you've given me and we'll be attempting to give you some answers. But obviously there's an awful lot of unknown at the moment. So starting off then with the practice has made quite a few changes to the way you operate because of the pandemic. And have you found any benefits from any of them, or is there anything that you would like to continue?
Well, I'd start off by saying that we have been open throughout the pandemic. We've changed a little bit how we work to keep everyone safe. So we have invested in technology, such as software that allows us to text our patients and in certain cases even respond back to us with an answer or a photograph. Patients are able to go to our website, and if they wish to send us an email, they can do it using the format called e-consult, which if you go to our website there is a link that's quite prominent, which you follow and you go through a lot of questions and it will be submitted to the practice and the doctor will look at it and get back to you either by email or pick up the phone and speak to you. So that's the second alternative communication we have set in place. We also have a text messaging system to tell patients about their results or any other scan results, so they don't have to make an appointment to come in and discuss, but if they wish to, they can get the gist of it in the text message and then they can call us back. The other method of communication we've set up as well is video links. So we can speak to you over a video link if need be, if we need to observe or examine a symptom or a skin lesion, for instance. So we've tried to make it such that there's many ways of communicating with us. If in the event we feel that we still need to see you, we'll make an appointment for you to come in. But this way we have reduced footfall in the practice.
That's brilliant. You mentioned the text messaging system that you use. I wondered if it has reduced the DNAs at the practice.
Yes, it has quite significantly. This is a text messaging system to remind patients of their appointment, and DNAs, non-attenders, have fallen to just 25% of what they were before.
Gosh, that's really fantastic. Well, that's one very successful introduction then, isn't it? Can I ask how many cases, what prevalence there was of COVID in the practice?
Yes, we can. We know that there were 14 cases within the practice. Sadly, some of those was from the local nursing home, and we had 4 deaths. There have been no deaths within the community, and all the people who have actually proven to have COVID have recovered well.
That's remarkable because there is quite an age demographic in this practice, isn't there? That's very admirable. There is some concern amongst the patients about all the news on the fact that this COVID is going to come back in the winter. We're going to have a second wave. What's your view on that?
I think our opinion is it will occur, and of course during the winter lots of viruses create more illnesses. So we've got to be prepared, and we are doing lots of preparation for just that eventuality. And I'm very confident we'll be ready and prepared for anything that COVID might throw at us over the winter.
Brilliant. Brilliant. What are your views on the vaccine development as well? I mean, that's obviously critical to the future. Do you think we're going to get a vaccine, and do you think when we do get it that we're going to go back to normal, or do you think this is going to continue longer, this social distancing and strange world we're in at the moment?
I don't think we have the answers to any of those questions that we can throw any light on. We don't do. I don't think we.
No.
Right, so we just have to carry on and see what happens next. I see. Will the flu vaccination programme be affected at all? The normal flu vaccination?
We want patients to organise their flu vaccination as soon as possible this winter particularly. I think that gives reasonably good protection against influenza and will reduce the risk of respiratory complications from that. So we'd encourage patients to book that up as soon as they can. And if they listen out for the national advertising programme, which starts in September, then get in touch with us as soon as that comes around.
Okay. Well, that's very reassuring. Do you think the eligibility criteria might change?
We think it might. We haven't received official notification from government yet, but it may well drop age-wise considerably, possibly to 50, but we don't know for certain yet. So watch this space.
So there's going to be a lot more flu vaccine needed.
Yes, yes.
I've been asked by patients to ask about their chronic disease clinics and when they're starting again.
Actually, we never stopped doing them, especially for asthma and COPD. We did quite a few of our reviews over the telephone, and we also sent out a questionnaire via text message for people to answer how they're managing the asthma or COPD. And the practice nurse would call them back and take it from there after looking through the questionnaires. So this is how we've modified our chronic disease reviews. But we are now starting to do the diabetic reviews and all other chronic disease reviews as well.
Thank you very much. There is also a question on the antibody test. I don't know who would like to pick that one up. The patient has asked, do you think that non-symptomatic patients will be able to request a test, and do you see any benefit in having the test?
We should talk about that.
Yeah.
There's not much benefit at all, is there? The rate is tiny. Out of the whole people in Shropshire, I think we've only had a handful who are positive.
Yeah.
Although a lot of people felt that they had symptoms, and then were surprised when they were negative.
Yeah. And those people who didn't have symptoms were found to be positive. So it's really hard at the moment, and it has to be a national programme.
Yeah.
So
It's mainly for research at the moment.
Right. Yes, they're doing that one big research thing, aren't they?
at the moment it's only for research. It won't be.
Yeah.
It will not be available by request for some
Okay.
time.
Well, I think that's been a very successful little run-through of patient concerns, and thank you all very much for your time. Just a quickie on the end, we will have a PPG meeting scheduled for October, and I wonder if we think we'd like to do it again like this, or whether you would prefer to look at Zoom or something more interactive with patients themselves.
I personally think I'd love to see social distancing, real people in a real hall asking real questions.
Yes, that's who we are.
That's what I would much prefer. So therefore, I would hope by October we can do that, and I think that'd be perfectly acceptable.
Yes. I'll book the village hall. Okay, thank you very much. So before we close then, is there anything that you would like to say to the patients?
Yes, remember we're still open and we always have been. If you're concerned about your symptoms or anything that you think might be abnormal, you're worried about, speak to us, come and see us as you normally would. And do not ignore your symptoms, please.
And if you are concerned about coming into the practice, please use the other forms of communication that we talked about earlier. So it is also, because of this, imperative for you to update your mobile phone number with us, please.
And finally, please remember your children need their vaccinations. They're so important. It's unlikely for a child to become unwell with COVID. Some of these other diseases can be quite catastrophic. Please come and have your injection.